Hello everyone, welcome to Dr. Lee's Evidence-Based Integrative Medicine, where Asian wisdom meets modern science. I'm your host, Chi-chan. In this episode, I would like to delve further into the topics of omega-3 and specifically focusing on the evidence of supporting use in various health conditions. I'll be discussing the use of omega-3 in 3 specific health conditions: cardiovascular disease, neuropsychiatric disease, and inflammatory disease. Here's a summary of the use of omega-3 in various conditions. You can take a screenshot, or if you don't have time to go through whole videos, you can refer this table for reference. I know there are other topics that people are interested in, such as ADHD, dementia, pregnancy, or lupus. I can tell you that there's a lot of evidence for using omega-3 during pregnancy, which has yielded great results, and I will present that in the future episode. ADHD is a more complex topic with mixed results in the literature, so I will address it individually in future episodes as well. So let's begin with the cardiovascular health. There used to be a significant interest among physicians in prescribing omega-3 for patients with heart disease 10 years ago. However, the level of interest has declined significantly since then. Both the American Heart Association and the studies published by Cochrane Library have shown minimal or no effect of EPA and DHA on cardiovascular health. So what has changed in the past 10 years, and how can I interpret the results? Well, this 2020 meta-analysis encompassed 86 randomized control trials involving a total of 163,000 patients to assess the effect of omega-3 in preventing cardiovascular disease. The results indicate that there is no significant difference in the risk of overall mortality or cardiovascular-related mortality. At the best, it may have minimal effect for preventing cardiovascular or coronary artery events, with a relatively high number needed to treat, ranging from 167 to 334 patients. It means that one need to treat 167 or 334 patients one need to prescribe omega-3 in that number to prevent one single cardiovascular event. Notably, ALA here did demonstrate some efficacy in preventing cardiac arrhythmia. Here I summarize the key findings of landmark trials. As you can see, in most of the studies, omega-3 was administered at a daily dose of 1 gram, combining EPA and DHA. As you may notice as well, that studies conducted after 2010 mostly demonstrate a non-significant effect. Well, so what is my take on this? Based on the evidence, it's likely unrealistic to just rely solely on omega-3 itself to prevent cardiovascular events, such as heart attacks. However, I will say though, it also depends on your diet content, whether you meet the daily requirement of omega-3 through dietary resources. It may be more worthwhile for somebody to take the supplement if their diet regimen lacks omega-3. It's also worth mentioning that many of the enrolled patients in those studies were already on statins, which are primarily drug of choice for high cholesterol, such as Lipitor or Crestor. While statins can have side effects, they are also powerful drugs for lowering cholesterol levels and improve outcomes of cardiovascular disease. In recent years, there also have been other drug development in the realm of cardiovascular disease, such as SGLT2 inhibitors. I'm left wondering that how much impact omega-3 itself can make while patients are already on multiple medications, including statins. How about heart failure? So when it comes to heart failure, the newly published guidelines for heart failure state that in patients with heart failure, also with symptoms, it may be reasonable to consider the omega-3 as adjunct therapy to reduce mortality and cardiovascular hospitalizations. So the recommendation is at 2B. The largest trial involving the use of omega-3 in heart failure patients is this GC heart failure trial. Sorry, I don't know how to pronounce it in the right way, which included 7,000 patients with NYHA functional class at 2 to 4. The omega-3 dose administered was at 1 grams of EPA and DHA combined, and this trial demonstrated a 2% reduction in overall mortality, as well as decrease in death and admissions related to cardiovascular reasons. Lastly, I would like to address the topics of using omega-3 to manage hypertriglyceridemia. Omega-3, particularly at a high dose, when I talk about high dose, that means 3 to 4 grams a day, remains an important option for treating hypertriglyceridemia. Here you can see the AHA Science Advisory saying that omega-3 at dose of 4 grams a day are an effective and safe option for reducing triglycerides, either as a monotherapy or as an adjunct to other lipid-lowering agents after any underlying causes are addressed and the diet and lifestyle strategies are implemented. As we talked about before, there are other options available for lowering triglyceride levels, which are listed here, such as fibret, niacin, zetia. Omega-3 supplementation can typically reduce the triglyceride level by around 30%. However, there's one thing need to be addressed when baseline triglycerides are above 500 mg per deciliters, and when we use high-dose omega-3, like 4 grams a day, there may be an increase in LDL. In such cases, when we prescribe a high-dose omega-3, I generally will recommend the patient to follow up with the providers and check their lipid panel periodically to make sure that LDL is under control when somebody is taking high-dose omega-3. In the section of omega-3 treating hypertriglyceridemia, AHA specifically summarized the side effects and the recommendations of a high-dose omega-3. Most side effects associated with omega-3 supplementation are mild and include issues like gas bloating or fish burps. The discontinuation rate due to these mild side effects is typically less than 5%. In regard to risk of bleeding, it's generally considered low risk, but I will say it's not non-existent, especially when individuals are taking high-dose omega-3 and already on multiple blood thinners. Certain herbs, such as ginkgo, can also increase the risk of bleeding. I would say that for individuals taking high-dose omega-3 and those are concerned about potential reaction with medication or other supplements and have a high risk of bleeding, I recommend you to speak to a medical provider to ensure safety and safety monitoring. Alright, we finished the cardiovascular health part. Let's move to the next topic, which is neuropsychiatric condition. There's a significant interest in omega-3 using in the neuropsychiatric condition because many neurologic disorders does involve a component of neuroinflammation, and we know that omega-3 has anti-inflammation properties. Additionally, it's interesting to know that 20% of brain's dry weight consists of polyunsaturated fatty acid. So maybe using omega-3, one of the polyunsaturated fatty acid, can modify the disease process in neuropsychiatric condition. The table here is my summary of various conditions and the current evidence surrounding them. As you can see, most of the positive study is focusing on the depressive symptoms. I don't see enough evidence to suggest using omega-3 in schizophrenia for the time being. And for dementia, I would say maybe there is a subset or group of patients that will benefit from dementia, but overall, there is no enough evidence to suggest to every patient with dementia. Autism spectrum disorder is more complicated and there is little and weak evidence of it, but we need to really focus and dig into the study design, and I would like to present that in a separate topic. Alright, so let's talk about major depression. So in 2021, there is a high-quality meta-analysis that published in the Cochrane Journal. It includes 34 studies comparing omega-3 to a placebo, and only one study comparing omega-3 to antidepressant. This study finds a small and marginal benefit for depressive symptoms overall, but with very low solidity evidence. So does this study put a final nail in the coffin for using omega-3 for depression because it has small or even non-clinical benefit effect? Well, the answer I would say is yes and no. There's another meta-analysis that conducted on the same topic, published in 2019. First of all, I want to point out that among these 30 studies, many of them using a different preparation of EPA and DHA. If you look at the left lower corner for summary, there are 2 studies using pure DHA, 3 studies using DHA dominant preparation, which means that you use mostly DHA and more than EPA. 8 studies using pure EPA regimens, and 16 studies using EPA dominant preparations. So it may be less accurate to combine all of the studies into one set of results, as many of them utilize different combinations of EPA and DHA. In the subgroup analysis, this study found a beneficial effect only for EPA-based regimens, and strangely to me at a dose of equal or less than 1 gram a day, but not for high doses, which is to me is counterintuitive, as the low dose work but the high dose doesn't, and DHA plays an important role in neurodevelopment, but DHA predominant preparation has no effect. We have to use the EPA-based regimen. I would suggest that based on the evidence, we should just take 1 gram a day of EPA or EPA predominant regimen. These unique studies explored the comparison between omega-3 and antidepressant, which is fluoxetine. In these studies, there are 48 patients with major depressive disorder that separate into 3 groups. One group is taking the EPA of 1000 milligrams, which is 1 gram a day. The other group taking fluoxetine, which is Prozac, at 20 milligrams a day. And the third group has a combination of fluoxetine and EPA. After 8 weeks of treatment, we can see that while the combination of EPA and fluoxetine leads to better depression score, and there was no significant difference between the fluoxetine group and the EPA group in terms of depression rating scale. Now, although this is a small study, I think it's fair to say that adding omega-3 as adjunct therapy on top of fluoxetine potentially has additional benefit to improve depressive symptoms. While this study showed there's no difference between the EPA alone group and fluoxetine alone group, I would say that it's probably too early to draw conclusion that omega-3 itself is comparable to the antidepressant. But I think that this phenomenon is something worth further investigation. How about residual depressive symptoms in bipolar disorders? This meta-analysis was published as a form of a letter to the editor in the bipolar disorder journals. And the evidence was relatively weak, as most studies were small and study design were heterogeneous. Overall, there was a small effect in the improvement of residual depressive symptoms. I would say that since that all the included trial using the dose of 2 to 6 grams a day, I would suggest to use the same dose for this indication. So that concludes the neuropsychiatric condition for omega-3 use. Right, the last part is about using omega-3 in inflammatory disease. Today we are going to talk about 2 health conditions which have more published literature to support. One is rheumatoid arthritis, and one is inflammatory bowel disease. Alright, let's talk about the rheumatoid arthritis first. In 2021, European Alliance of Association for Rheumatology made a recommendation of diet on outcomes of rheumatoid arthritis. They reviewed 3 previously published meta-analyses and associated trials, and made a recommendation that with moderate quality of evidence, fish oil may have a small effect on pain, but no effect on function or disease activity. The most recent meta-analysis of inflammatory rheumatic disease was published in 2022. In this article, they include a total of 30 studies. 25 studies on rheumatoid arthritis patients, 1 study on ankylosing spondylitis patient, and 3 studies on psoriatic arthritis patients. Overall, there is a mild improvement of pain, swelling, joint tenderness, disease activity, and health assessment questionnaire from polyunsaturated fatty acid. The subgroup analysis also showed that omega-3, in comparison to omega-6, is more effective to achieve health benefits. This study also found that animal-derived products are more effective than plant-based ones. The supplement should be used for at least 3 to 6 months, which makes sense to me because they need time to work on genetic expression. Additionally, it's worth noting that most studies using a high dosage, equal or more than 2 grams a day. My take on is that omega-3 may offer small to modest benefits in terms of pain in patients with rheumatoid arthritis. And I think for the disease activity and joint tenderness, we do need more studies. The effective dose remains unclear, but I think that if we have to use the omega-3 for rheumatic disease or rheumatoid arthritis, I think that we should use a high dose at 2 to 3 grams a day for at least 3 to 6 months to achieve optimal benefits. And it's maybe preferable to use omega-3 from animal origin. In the spirit of integrative medicine, I would say we'll not solely rely on omega-3 to achieve anti-inflammation. Instead, in this scenario, we'll combine multiple modalities, such as Mediterranean diet, inflammatory diet, other supplements like turmeric, and exercise, yogas, or mind body medicine, all together to achieve the optimal anti-inflammatory benefits. Okay, how about inflammatory bowel disease, such as Crohn's disease or ulcerative colitis? Based on the current literature, there is not enough evidence to support the use of omega-3 dietary supplements in those conditions. However, the guidelines do recommend to increase dietary consumption of omega-3 from fish, and this recommendation is based on 2 studies. One study showed that there's a significant decrease in disease activity in patients with ulcerative colitis who consume at least 600 milligrams of Atlantic salmon weekly for 8 weeks. In another study, it showed that patients whose diet approximately with omega-3 and omega-6 ratio close to 1 were more likely to achieve the remission status compared to those who has high omega-6 to omega-3 ratio. This graph illustrates the recommendation of increased fish consumption for patients with ulcerative colitis. The most recent meta-analysis about omega-3 use in inflammatory bowel disease was published in 2010 in the European Journal of Nutrition, which includes 83 randomized controlled trial with total of 41,000 patients. The study shows there's overall little or no effect on the prevention or the treatment of inflammatory bowel disease. This is the forest plot of the studies and break down into the ulcerative colitis or Crohn's disease, and both of which show no statistical difference. Again, similar to the scenario with the cardiovascular events, I believe that relying solely on omega-3 to prevent or treat inflammatory bowel disease is not realistic. However, it depends on patient's diet intake. I will say that if patients have a low consumption of omega-3 at baseline, we can encourage fish consumption, even encourage patients to take supplement. This table summarizes the evidence of omega-3 in various health conditions based on my personal understanding and the literature. I acknowledge that there are many different opinions and comments based on patients' personal experience and interpretation of the studies, so I'm open to discussion and appreciate any feedback. Overall, I believe that omega-3 is a safe dietary supplement with the potential of multiple health benefits in various health conditions. I commonly suggest for patients who may experience mild depressive symptoms or have a background of cardiovascular history. I usually tell them to start with 1 gram of omega-3 daily since it has minimal side effect and potential benefit for helping with the depressive symptoms. For autoimmune disorders, I generally don't have much experience, but certainly based on the medical evidence, those patients may require higher dosage of omega-3s and a longer period of time to achieve optimal benefits. Last, I would say optimize the dietary intake of omega-3, for example through the fish consumption, and maintaining a low omega-6 to omega-3 ratio like a balance of yin and yang, may exert long-term health benefits. Thanks for your attention today.